The AKIKI trial, a pivotal study in critical care nephrology, tackled the dilemma of when to start renal replacement therapy in ICU patients with acute kidney injury. Conducted across multiple centers in France, the trial randomized 620 patients to either early or delayed RRT, with the aim of comparing survival rates at 60 days. Contrary to expectations, the AKIKI trial found no significant difference in mortality between the early and delayed RRT groups. The mortality rate was 48.5% for early RRT and 49.7% for delayed RRT. Notably, nearly half of the patients in the delayed group recovered without ever needing RRT, although those who did require it were in worse health initially. These findings challenge the notion that earlier is always better for RRT initiation. With no guidelines yet reflecting the AKIKI results, clinicians are encouraged to weigh the risks and benefits for each patient. The study underscores the need for personalized care and further research to optimize treatment strategies for those with acute kidney injury in the ICU.